The Social Enterprise Fund was created in 2007. It's helped about 150 organisations to date. They've been very successful, and I'd like to see a lot more organisations tapping into that fund. Social enterprises are businesses that reimburse the surplus, the profit they make from their business, back into that business or back into the community. Anybody who's part of a social enterprise at the moment and wants to develop new services and is working with patients or users and can think of new services they want to provide or expand, the fund is for them. We created the Social Enterprise Investment Fund within the department to begin with, and we had a panel of experts and our enterprise unit there to give out the original grants. But we've now brought in Futurebuilders, working in partnership with Partnerships UK, to help manage the fund for us, to assess the applications, to help to make sure that we market and promote the fund so that the fund does get out there, does get the money, the loans, the grants, the equity investments out there to social enterprises. So we've brought Futurebuilders in, who bring in a huge amount of experience and knowledge and understanding of the world of social enterprise, and know and can help us to make sure that we get the best value for money from this fund, and we get the best social enterprises delivering great health and social care throughout the country. In Sunderland, they set up something called Sit and Be Fit, which was a great social enterprise to encourage people who maybe don't have much mobility, but nonetheless can get fit through doing exercises whilst they're sitting down. And that's one of the important things that I think social enterprises like that can do, is they can reach out to parts of communities that wouldn't otherwise be receiving health services. And once they've accessed the service through the social enterprise and started to do something, well, then they can access a bit more and get to see their GP and use other health services in the mainstream. One of the key outcomes that I want to see from the Social Enterprise Investment Fund is more social enterprises being more innovative in the way they go about delivering health and social care. We know if we ask people, service users, patients, staff, have you got any new ideas, new ways of working, things that might be a better way of delivering a service? Well, they certainly have. We know that if we engage people in that way, new ideas come out all the time. And that's partly what I want to see being delivered through the Social Enterprise Investment Fund. That's my ambition for the fund and for the social enterprises, that it will carry on to develop and support in the future.